Hello everyone and welcome back to my channel. I am Dr. Rastha here, and today's video is about on the topic of inflammation, which is very important for pathology theory exams. In this video we are going to learn about the definition of inflammation, causes of inflammation, the signs of inflammation, and types of inflammation. So starting with the definition, inflammation is defined as local response of living mammalian tissue to injury from any agent. So inflammation is defined as local response of living mammalian tissues to injury from any agent, and it is a body defense reaction to eliminate or limit the spread of injurious agent followed by removal of the necrosed cells and tissues. So the introduction of inflammation, we start with the definition as local response of living mammalian tissues to injury from any agent, and it is a body defense reaction to eliminate or limit the spread of injurious agent followed by the removal of necrosed cells and tissues. Next we should know about is the injurious agent causing inflammation. Okay, so the very first we have the infective agents like bacteria, viruses and their toxins, fungi and parasites. Then we have our tissue necrosis caused by various agents such as ischemia or physical agents. Physical agents may include heat, cold, radiation and mechanical trauma, or can have chemical agents which includes organic and inorganic toxins. Then we have the immunological agents like the cell mediated and antigen antibody reaction, and fourth cause of inflammation can be the inert materials such as dirt, sutures, foreign bodies, etc. Okay, so these are the causes of inflammation. Now comes the very important signs of inflammation. Signs of inflammation can be asked as an MCQ in your theory papers or in any of the competitive exams. Also as a short answer question, it can be asked. So earlier there were only 4 cardinal signs of inflammation. 4 cardinal signs of inflammation. That was rubor, which means redness. We had tumor, which meant swelling. Then we have calor, meaning heat, and dolor, meaning pain. पहले हमारे पास यही 4 कार्डिनल साइंस ऑफ इन्फ्लेमेशन थे, बट देन 5th sign of inflammation was added, which was called as functiolesa, which meant loss of function, and it was later added by Galen. Okay, so now we have 5 signs of inflammation. Then we have the types of inflammation, the 2 types of inflammation, and depending upon the defense capacity of the host and duration of response, inflammation is classified into acute and chronic inflammation. So very first, acute inflammation, it is of short duration, lasting less than 2 weeks, and it represents the early body reaction. It resolves quickly and is usually followed by healing. Okay, and what is chronic inflammation? So chronic inflammation is of longer duration, occurs after delay. It occurs either when the causative agent of acute inflammation persists for a longer time, or the stimulus is such that it induces chronic inflammation from the beginning. Okay, so this is the major difference between acute inflammation and chronic inflammation, and these are classified depending on the defense capacity of the host and the duration of response. In today's video, we learned about the definition on inflammation, causes of inflammation, signs and types of inflammation. And in the next video, we are going to learn about acute inflammation, that is the acute inflammatory response, and its 2 components, the vascular events and cellular events. So stay tuned for the next video, and in case of any doubt, you can comment down in the comment box. Thank you.